Welcome to Flight Path, the podcast where we explore the journeys behind bold leadership, innovation, and impact. This is where we talk real career journeys, the bold moves and messy pivots, the plot twists that no one puts on LinkedIn, and the moments that changed everything. We're sitting down with leaders, innovators, and rule breakers who figured it out by doing the work, learning the lessons, and sometimes ignoring the map altogether. If you're navigating leadership, healthcare, tech, or just trying to figure out what's next without losing your mind, you're in the right place. So fasten your seatbelts, adjust your altitude, and let's take flight, because we're broadcasting live from Las Vegas at HIMSS 2026.
Hey everyone, and welcome to another episode of the Flight Path. Today we have Miss Wendy, President and COO of Divurgent, an amazing consulting firm. Welcome, welcome.
Thank you, Rebecca. So good to see you today.
So good to see you at HIMSS. I'm so glad I didn't get to see you at Vive. I was so sick.
I know, I heard. I'm so sorry that was the situation.
Yeah. So welcome. What are you excited most about coming to HIMSS this year?
Absolutely. I would say my most excitement is seeing colleagues, friends. It's a wonderful opportunity for those reconnections. But for us at Divurgent, we're really looking at opportunities to connect and partner and just really talk healthcare with kind of the buzz that's happening and the adjustments that are happening.
Tell us some of your biggest projects this year and a little bit about what Divurgent does.
Absolutely. So first and foremost, we're a professional consulting services firm, and our key four capabilities and solutions align with, first and foremost, where our foundation of 18 years has been in training and go live implementation, and then our talent staff augmentation components where we can help fill those gaps within entities. And then a newer over the last couple years is our managed service line, and both in Epic and Cerner have been able to provide that kind of tier one help desk and application management managed service. And then finally, we've got a couple key accounts in the Northeast that we've helped with some advisory services and assisting them. Could be merger and acquisition capabilities, as well as some optimization, OCM governance pieces. So we've had a host of projects. We crossed any one of those four capabilities and solutions, and are really excited about some of the conversations and areas that we're able to assist organizations here in 2026.
I just know you guys as just an epic powerhouse.
Yes.
That's just always been your bread and butter, with some of the brightest on your team, Sarah, Dana, Peter.
Absolutely.
Pat Monday, I'm calling you out, girl.
Yes.
I've had a chance to interact with all of them, and you just have just amazing team that can just get it done.
Absolutely spot on. And if anybody asks me what is a differentiator, what is the key thing, I start with the people, because I've had an opportunity to work in a number of consulting organizations in my career. Great organizations, great people, but what keeps me here, what keeps me going are the people that I get the opportunity to work with, their knowledge, their experience, we're exclusively healthcare. They are all healthcare. Yes. They've been at Epic, they've been at Cerner, they've been in health systems, and so they bring real knowledge, experience, and capability. And then on top of that, they're just great humans. So yes. They're fun to be with, fun to hang out, and really have the health systems and our healthcare, our patient elements at the forefront of what they do.
And you wouldn't have any of them working unless, we'd be remiss not to call out Liz and Danny on your sales team to get everything started and their knowledge. And Liz has been with you for so long.
Yes.
Knows so many.
Yeah, Liz has been with us 12 years. Danny is new, but really taking a look at our business development, on our strategy, and as it relates to HIMSS, really focusing in on the state and the chapter levels to have those conversations, learn what's going on, recognizing the funding that's happening on the federal and the state levels that are relevant to the health systems. So very much our business development team having an opportunity to be out there present, having conversations.
So let's turn the light on you.
Okay.
Because I just love your story and how you've gone about life as sort of a nomad. And I watch YouTube channels all the time of everybody living in the RVs and getting to travel and seeing the world, but then also being able to work, because we have an opportunity to be able to work from anywhere.
We do.
And so tell everybody about all your adventures.
Okay, so yeah, I mean, I'm certainly unique. I have had a remote position for over 29 years. So before my daughter was born, and yeah, all in healthcare, all in professional service organizations of different sizes and scope. So that has been a huge asset that I've been able to live. Most of my life has been in the Midwest, but 9 years ago, my daughter was a junior in college, and I made the decision with my passion of travel to step out and went on the road and chose an RV to try it for a year. Ended up loving it. Been out on the road for 8.5 years, and have been to Alaska, have been through Canada, United States, Mexico. It's given me opportunities to visit with our team members where I can connect with them when I'm traveling in certain areas, being able to connect with our clients and have an opportunity to see our wonderful country and surrounding countries from us. So when anybody asks me what's your favorite thing, and there's so many great national parks, the Grand Canyon, all these things, they are wonderful. Absolutely, if you get a chance, go. But for me, it's this little town or this little area that you would never have a chance if you didn't grow up in that area, didn't know about it. And then with RVing, I got the chance to stay 2 or 3 more days and get to explore it. So the local restaurants or the activities or the arts or whatever it's known for, that's what I really enjoyed, is getting to see things I wouldn't have if I didn't get out.
Should have started a blog on all the, diners and everything.
I did. I love food, and I have so many friends that do the blogging. With working full time, I just said, I want to just enjoy it. I don't want another job, but I do have lovely pictures, memories, stories, and I can just walk through my phone and say, oh, remember this, and I love it.
I love it. So you all have supported Bluebird since the inception.
Yes, I was an early adopter of getting in.
And Divurgent as well. So why support Bluebird, and why is it so important to you?
Oh, you know what? The mission of healthcare and women and technology, the combination of those three are important. And, serving as a board member in a health system, being present in healthcare and technology consulting, it's just an awesome way to connect, network, promote, help, mentor, all the things that Bluebird. So it brings the package together to help lift up in what we do. And so I love the mission, I love the purpose, and at this point in my career, want to give back. And so if there's a way I can do that, certainly want to share my experiences, my opportunities, and how can that help someone else?
Yeah, you all have watched it grow from the beginning. So
yeah.
We're so thankful for Divurgent and your sponsorship at Happy Camper tonight at HIMSS. We'll have over 300 people. We can't wait to see you there.
Yeah,
Thank you so
what
much.
an opportunity for hosting it so that we get the opportunity to network. And so excited for you and your success and all that you do.
Thank you.
Thanks.
Awesome. Thanks for coming, everyone. Wendy from Divurgent. We'll see you soon.